Let's hone in on what is the top story here in South Africa today. An emergency National Coronavirus Command Council meeting will be held this morning. That's after South Africa hit 1 million confirmed COVID-19 cases. Daily infections are now averaging just over 12,000 and deaths are around 430 a day. So far, more than 30,000 people have died of COVID-19 in South Africa. Now, government communications officials have rubbished claims that another hard lockdown could be announced as the adjusted level 3 lockdown is due to expire on January 15th. Let's unpack the story now. We're joined by Professor Alex van Den Heever from Wits School of Governance. Professor, as always, a pleasure having you here on the show. There's always, when we hear of the Coronavirus Command Council meeting, there's always talk of another lockdown possibly being on the cards. But I think it's fair to say now, given the impact it's had on our economy, that likely won't happen.
I do not see any movement to increase the sort of move from the current restrictions to a lockdown that will affect the rest of the economy. I think the devastation that the first lockdown had for South Africa has shown clearly that this can't be done. So I think that the question really is whether or not the focus is going to be on proper enforcement of the current set of restrictions, which are not all focused on the economy, but largely on gatherings and crowded spaces and the areas where super spreading is a high risk, which is the area where the aspect which we need to control.
Yeah, the lockdown has been effective and we've seen it. The lockdown level 3, the adjusted lockdown level 3, in terms of those super spreader events has been effective. If we just take one example, the example of Chris Hani Baragwanath Hospital over New Year's, it's never happened before, not reporting any trauma cases.
Yeah, so that is assisted with trauma-related cases, but the question is whether the current restrictions have impacted on transmission. And I think it's still too early to tell in all the provinces, because when the lockdown was introduced, a lot of the infections are kind of baked in. And it takes a while before you get to see the impact of the restrictions on the epidemic itself. And Western Cape and Eastern Cape have stabilized in terms of new infections, but Gauteng and KwaZulu-Natal were on a strong upward trajectory when the restrictions were introduced, and that was invariably going to continue. And so that those two provinces, although there are other provinces involved still increasing, other than the Eastern Cape and Western Cape, Gauteng and KwaZulu-Natal will dominate the overall trend.
Yeah. Professor, if we take a look back at March, when the hard lockdown was first introduced here in South Africa, back then we knew it was not going to have an impact on the trajectory of infections in our country. Is that fair to say? The lockdown really was just aimed at that time, aimed at giving our hospitals time to prepare for what was to come.
Yeah, I think there's still quite a lot of debate about what the level 5 lockdown achieved and whether or not a more moderate set of restrictions, such as the current level 3 restrictions, would have been introduced. I think the level 5 lockdown, large parts of it were probably unnecessary to prevent the transmission. I think South Africa largely copied a number of other countries in terms of a severe lockdown, shutting down businesses, and the lesser restrictions that actually impacted on the gatherings probably had an effect, but the rest probably had very limited effect.
So if you were to, give a recommendation on how we should proceed in the coming weeks and months, would you make any changes to the current level 3 lockdown?
I wouldn't. What I would focus on is enforcement of the current regulations, because internationally it's also been shown that it's the super spreader events that are largely driving increases in transmission. It won't be, for instance, people coming back from KwaZulu-Natal to Gauteng or from the Western Cape. It's going to be whether or not you've had gatherings where 2 people have infected 50. And that's what we had in spades in November and in early December. So as people became quite complacent, those are the high-risk incidents. So I think that what we should see is continued enforcement and monitoring, we will really only see the effect of these sets of restrictions in just over a week from now.
Yeah.
Probably after the 15th.
Yeah. In terms of, other big issues that will certainly be on the agenda at today's meeting of the Command Council, we had that briefing from the Health Minister and his team around vaccines that took place just earlier this week, a few days ago. It was a briefing that was, long overdue, many would say. There was a silence on vaccines, while 29 other countries around the world had already rolled out their vaccination programs. We still had no clarity. It's arguable whether we have enough clarity even today. Where are we in your understanding on the vaccines issue?
Well, in terms of what is public, very little is known about what they've been doing, whereas in many other countries, their strategies are very clear. So even if they might not have started vaccinations, it's quite clear what they're doing. I think it's very unfortunate that when we're sitting in a crisis like this, when we're also having to impose restrictions, a key aspect of prevention going forward that should have been in preparation for the last 7 months has apparently not moved at all. So I think that the briefing on Sunday was largely a reaction to huge pressure, which was necessary because they were not moving. But I think that they're probably trying to move now, but it's a question as to whether or not we've lost ground in terms of being able to begin rolling out a major vaccination strategy from February.
Yeah, absolutely. In fact, there is a story this morning on News 24 around, the fact that, in fact, our health officials had cancelled a meeting back in August with Johnson & Johnson, which is conducting a trial here in South Africa, a meeting around vaccines. So that meeting was pushed forward, happened only in September. I mean, these issues are now coming to light. We spoke to Health Minister Dr. William Kizer on the show just yesterday. He says, for anyone who has criticized government's response in terms of vaccines as lagging behind, that person doesn't have a proper understanding of what goes into a process like this. It's becoming very, very difficult, though, as you say, not having clarity, even on January the 7th today, to put it down to a lack of understanding when so many other countries, as you say, have a plan in place, even though they haven't started their vaccinations.
Absolutely. The issue, I think that the minister's comment is incorrect. People, certainly what should be transparent at this point is what they have been doing to prepare a rollout. It does take a fair degree of work, and that's a large reason. That's a reason why there's huge criticism of government at this point, because it appears that they didn't do any of that preparation. So just saying that we should be sitting in their rooms and hearing what they're doing is not adequate, because if they had been working, we would be seeing that effect now. So we would be seeing the approvals. We would have seen that they were proactive, that it isn't the pharmaceutical manufacturers who are trying to get to government to have meetings. Government should be organizing the meetings with the pharmaceutical manufacturers and pushing for our needs in South Africa. Other countries have done it. Many lower income countries, middle income countries have done it. We apparently have done nothing and are now in a mad scramble to try and catch up, probably because pressure has been put by the president on the Minister of Health, and not because they were doing their job when they should have.
Sure, that's an incredibly worrying thing. Professor van den Heever, thanks very much for your time this morning on the AN Report. Professor Alex van den Heever from Wits School of Governance. Of course, we will get more clarity, or we're hoping to get more clarity once we have a report back from the National Coronavirus Command Council.